Kauvery Hospital, Radial Road, where we are all from, was launched in May 2023 with Centers of Excellence in Neuroscience, Cardiac Science, Renal Science, Gastro Science, and Kauvery. Under Kauvery, we also we cater the women and child fraternity. We also cater to the neonatal segment, where we have 20 plus beds for neonat alone. The purpose of this event is we have Dr. Sridhar, who has operated on a patient, has successfully done an operation, and he has created a positive impact on someone's life. And that's what we are going to share. We are going to share that experience with you, and this event is all about that. I take this opportunity to welcome Mr. Veerasamy and his family, who graciously accepted for coming for this event and sharing their experience with us. Thank you.
Thank you, sir. Thank you very much. I would now like to invite Dr. Krish Sridhar, Group Mentor and Director, Neurosciences, Kauvery Hospital, Radial Road, to join us on stage, please. Dr. Panay, Head Senior Consultant, Neuro Anesthesia and Critical Care, Kauvery Hospital, Radial Road, to join us on stage. Mr. and Mrs. Veerasamy, to join us on stage as well, please. And Dr. Anil VG, Medical Director, Kauvery Hospital, Radial Road. I request everybody to kindly be seated. So we have Dr. Krish Sridhar honoring our guests for the day, Mr. and Mrs. Veerasamy, with a big round of applause. We welcome you here today. And I request Dr. Krish Sridhar to provide you further details about the surgery and its impact on the patient and his family. So please.
Good morning, Vanakkam, Namaskaram. First, thank you very much for accepting our invitation to come here today. I would specially thank Mr. Veerasamy, Mrs. Veerasamy and his family for accepting our invitation to do what I think is a social service. இங்க பாத்தீங்கன்னா இங்க ஏஜ் நோ பார்னு போட்டிருக்கு, and that is what we are trying to do. We are trying to say that in any surgical procedure which is essential, age is no longer a bar. If somebody has a problem which has to be solved, we do not look at the actual number of the age. That is not necessary nowadays, because technology and medical science has progressed so much. We operated on Mr. Veerasamy for a condition called trigeminal neuralgia. I'll just give you a small brief on what it is, and then you can hear from the patient himself on what he suffered. But I'll just give you a small background on this. You have a nerve called the trigeminal nerve, which takes sensation from the face to the brain. So this is called the trigeminal nerve. So all sensation from the face, from the left side of the face goes to the brain, right side of the face goes to the brain. And trigeminal neuralgia is a pain condition where you have a shock-like pain. It's an electric shock-like pain. Somebody who has not suffered it cannot imagine that pain. It's a shock-like pain which comes by anything. You touch the face, you get the pain. There is the AC blast, you get the pain. You open your mouth, you get pain. You try to eat, you get pain. So any sensation is felt like pain, and this is called trigeminal neuralgia. How do we diagnose it? It is only by what the patient says that we make a diagnosis. It's very classical. ஒரு patient நீங்க பாத்தீங்கன்னா their story நீங்க கேட்டீங்கன்னா all of you can diagnose trigeminal neuralgia because it is so classic. And then we do an MRI just to make sure the patient's cause for the trigeminal neuralgia, what is it? Is it a tumor? Is it something else? Is it fluid? What is it? So that we don't miss any problem that is causing it. Most often, if there is no tumor, cyst or anything, the cause is what is called neurovascular conflict. Medically, that's a big word. But basically what it means is that there is a blood vessel which is sitting in direct contact with the nerve. Now, so what? It is a normal blood vessel, normal nerve. But the problem is that the pulsation of the blood vessel. When the pulsation goes on hitting the nerve gets irritated. If somebody sitting next to you goes on tapping you, for some time you will be quiet. அதுக்கப்புறம் இன்னொரு பக்கத்துல யாராவது உட்காந்து ஏதாவது ஹலோன்னு சொன்னாலும் கல்லுன்னு விழுவேன். அதே மாதிரி the blood vessel is pulsating and irritating the nerve so much that any sensation which the nerve gets, it is transmitted to the brain as though it is pain. And this is what is called trigeminal neuralgia. The cause is the blood vessel which is hitting on the nerve. And therefore all sensation is felt like pain. Now how do you treat this generally? Generally the first and the best treatment is medicine. And there is only one medicine which actually works. That is called carbamazepine. That works. It should be given in small doses, starting with small doses. But there are some patients in which the medicine does not work, or despite taking a lot of medicine, the patient still gets pain, or medicine side effects happen, therefore the patient cannot take. And this has to be taken lifelong if you are going to take medicine. So very often patients, when they are young, they start it very enthusiastically, but somewhere along the way, அதான் வலி இல்லையா நிறுத்திடலாம். So they stop it. So the pain comes back with a rebound which is almost double and then becomes very difficult to control. So when the patient's pain does not get controlled by medicine, you have to have some procedure or intervention. That is very clear. Now what are the types of procedures and interventions? One is surgery, which is called microvascular decompression, which I am going to talk to you about, which we have done on Mr Veerasamy, which is physiological, which means all that we do in the surgery is, I told you there is a blood vessel on the nerve. All that we do is move it away from the nerve. Simple. Normal blood vessel, normal nerve, we don't destroy anything, we don't cut anything, we only move it away. That is physiological. We are not damaging anything. There are lot of other procedures which are so-called minimally invasive because they use needles and other things, but which destroy. So therefore they are called ablative procedures. So they are destructive procedures. It can be glycerol injection, radio frequency, gamma knife. There are many like that which are available. But in my mind, I do not like to destroy what nature has given normally. Why should you destroy? It is so easy to destroy but very difficult to build. So the microvascular decompression surgery is something which should be done and gives the best long-term results. That is also important. This gives the best long-term results of all interventions. other interventions give good results, but most often they have a high recurrence rate. So what do? We make a small incision behind the ear, and then we make a small opening in the bone. Mr. Veerasamy, if you look at him, meet him in some wedding reception, you can't even know that he's been operated, because there's no, you can't see it on his face. And then if this is the blood vessel which is hitting on the nerve, we move it away and put some muscle, which is tissue which is locally got from the incision, to move the vessel away. So this is from another person's surgery, where if this is a blood vessel, this is the nerve. So this is, and this surgery is done with an operating microscope under very high magnification. Apina, something which we see, we magnify it about 10 times, 15 times. An example is, I'm sure all of you have seen the movie Dalapati. Have all of you seen? Yes?
Yes, sir.
There is one scene there where Rajinikanth is following his mother into the temple, and Ore or Mallipu falls on the floor. Remember that scene? And then the camera zooms into that Mallipu so that the entire field or entire screen is only that Mallipu. So what happens, you can see all the details of the Mallipu, and that is what is microscopic surgery. So you can see every detail, and that is the best part. So when we see like this, it is not so big, it is actually small, and the instruments which we use are less than a millimeter in size at the tip. They are 0.3 millimeter, 0.6 millimeter, and the madri. So they are very fine, and therefore this is how we see it, and the nerve is pushed away. So you can see a nerve sometimes, you can see it is like a groove here, it is almost like a hill here. The nerve, it gets badly affected and then it becomes very nice here. Now Mr. Veerasamy had a MRI like this, you can see this long black thing, that's a blood vessel. He had a large blood vessel which was pressing on the nerve. And this is his surgery. I'm sorry Mr. Veerasamy, I'm showing you your surgery. I hope you don't mind. So we do this like this, the large vessel is here, and that's the nerve, right, which is pushed right on top. So under very delicate circumstances we operate, that's the basilar artery there, and then we push the tissue between the nerve and the vessel and move it away. So there is no need to worry. This is the message which I want to give. There is no need to worry if there is trigeminal neuralgia, because there is a long-term solution. The surgery is a very delicate surgery. It's a very delicate surgery. It's a procedure which has the best results for long-term cure. And it is also safe. We have in our department over years done more than 500 such procedures. So we have got the experience, the technique, the technology to make it a safe surgery. And finally, what I would say, this is not a tumor which is going to kill the patient. This is a pain which affects quality of life. ஒருத்தருக்கு உயிர் போற மாதிரி வலி இருந்ததுன்னா அது living itself becomes hell. Therefore, it is very necessary, whatever the age, we should give them a cure. We should give them a long-term cure. And that is the most important thing as a doctor. As a doctor, you must help the patient. Not say, I can do this very well. That is not the idea. You must help the patient. So if you help the patient get rid of their pain, you have done your job as a doctor. And that is what. And age is not a bar for that. 60 ஆச்சு, இனிமே என்னன்னா இனிமே என்னன்னா வலி இருக்கேப்பா. How can I live life? 70 years, so what? That is the time you need to live life. And currently speaking, all over the world in medical science, old age, the definition of old age has gone from 60 to 75. Because that's how medical science has progressed. But I would like now, I have told you something medically about it, but I would like you to hear from Mr. Veerasamy now, can just give him the mic, about his experience, and also from Mrs. Veerasamy. She's the wife, she knows exactly how her husband suffered. Sir, please. Thank you, doctor.
எல்லாருக்கும் வணக்கம். என் பேர் வீராசாமி. 85 வயசு ஆகுது. இந்த மார்ச் மாசம் இந்த ஆண்டு 85 முடிஞ்சு 86க்கு போறேன். நான் இன்னைக்கு இந்த இடத்துல உட்காந்து உங்க கூட பேசுறேன்னா இந்த மாதிரி அதுக்கு முழுக்க காரணம் டாக்டர் ஸ்ரீதர். அந்த ட்ரைஜெமினல் நியூராலஜியான்னு அவர் சொல்றாங்க. அது இப்ப தெரியும் எனக்கு. அதனால நான் ரொம்ப கஷ்டப்பட்டிருக்கேன். பல வருஷம் நான் கஷ்டப்பட்டிருக்கேன். இன்னும் சொல்ல போனோம்னா 15 வருஷமா கஷ்டப்பட்டிருக்கேன். ஆரம்ப காலத்துல அது என்ன காரணத்துல தெரியல. ஒரு நாளைக்கு சாப்பிடும்போது திடீர்னு ஒரு ஷாக் அடிக்கிற மாதிரி. இந்த இடத்துல இன்னொன்னு சொல்றேன், எல்லாருக்கும் உப்புன்னா என்ன இனிப்புன்னா என்ன தெரியும், ஏன்னா சாப்பிட்டுருக்கோம். ஷாக்குன்னா என்னங்கிறது இட் cannot be explained, it has to be experienced. தொட்டு அது இருக்கும் போதுதான் ஷாக்குன்னா என்னன்னு தெரியும். சொல்ல புரியாது, சொல்ல முடியாது, விளக்கவும் முடியாது. அந்த முதல் வரும்போது அதெல்லாம் ஒரு செகண்ட் 2 செகண்ட் தான் இருக்கும், ஜாஸ்தி நேரம் இருக்காது. அப்ப நான் என்ன காரணம் தெரியாம விட்டேன். அப்புறம் அது ஒரு 3-4 மாசத்துக்கு ஒரு தடவை, அப்புறம் ஒரு 2 மாசத்துக்கு ஒரு தடவை, ஒரு மாசத்துக்கு 2 தடவை, இந்த மாதிரி கொஞ்சமா வருஷம் இன்க்ரீஸ் ஆச்சு. ஐ திங்க் 1998 ஒரு 5 வருஷம் 6 வருஷம் முன்னாடி அதனுடைய வீரியம் ஃப்ரீக்வன்சி அடிக்கடி வருது. அது